Welcome back, everyone, to another episode of our Patho for Nurses. I'm Scott Krueger, and in today's lesson, we're going to be talking about the cardiac system. So very important that we understand the anatomy and physiology of the heart, know what the heart does, and then that'll allow us to understand better when something is going wrong with the heart. So the heart acts as a pump to help circulate blood and all of its constituents, which include oxygen, hormones, nutrients, blood cells. The heart does that to circulate all these things around the body to nourish cells and tissue. We got 4 chambers of the heart: right atrium, right ventricle, left atrium, left ventricle. We have 4 valves that are inside of the heart. The Atrioventricular valves are the tricuspid valve that connects the right atrium with the right ventricle, and then the mitral valve, which is on the left side of the heart, and that connects the left atrium and the left ventricle. And then we have 2 other valves. We have the pulmonic valve, which allows blood to go inside the pulmonary system, and then we have the aortic valve, which is what leads up to the aorta. And the purpose of the valves is to help prevent a backflow of blood. We want blood in the heart going in one direction. We don't want it backing up. So later on, when we discuss some of the valve defects, there can be blood that's backing up in other parts of the body where we don't want it to go. So those valves help blood keep going in the same direction. Also important to know, we got 3 layers of the heart tissue. We have the epicardium, which is the outer layer of the heart, the myocardium, which is the middle layer of the heart. That is very important. It's where our muscle is thickest in our heart. And then we have the endocardium, which is the inner lining of the heart. Very important to know that the blood that's inside of the heart does not nourish the heart tissues itself. We have what is known as coronary arteries that help feed the heart muscle and provide it with nutrients and blood and oxygen and all those wonderful things. Also important to know, the heart is enclosed in a double-walled pericardial sac. The purpose of that sac is to help provide an extra layer of protection for the heart. It also keeps the heart in place so that it's not jumping around the chest too much. You know, when people's heart rate really goes up, that heart really gets to moving, that pericardial sac kind of helps keep it in place and then protects it. Some important terms that we want to consider with our cardiovascular content: tachycardia, that is where the heart rate is above 100. Bradycardia, heart rate is below 60, so normal heart rate is usually around 60 to 100. Looking at cardiac output, abbreviated CO, that is the amount of blood that the heart pumps through the circulatory system in 1 minute. The formula for calculating cardiac output is cardiac output equals stroke volume times heart rate. And that stroke volume is the volume of blood that is pumped out of the left ventricle of the heart during each systolic cardiac contraction. Preload refers to the mechanical state of the heart at the end of diastole with the ventricles at their maximum load. Afterload equals the amount of resistance the heart must push against to eject blood. Looking at blood pressure, systolic blood pressure, that's the top number. That's the pressure exerted when the heart beats and blood is ejected into the arteries. Diastolic blood pressure, that's the bottom number. That's the pressure in the arteries when the heart rests between beats. The way that we calculate blood pressure is cardiac output times peripheral resistance. So peripheral resistance meaning how constricted or relaxed your blood vessels are. So the more constricted your arteries or veins are, the harder your heart is going to have to work to pump blood through the whole body to help nourish your cells and tissues. Hormones that contribute to blood pressure are ADH, also known as antidiuretic hormone. Antidiuretic hormone tells your body to hold on to fluids. And the more fluid you hold on to, the harder your heart has to work to pump all that fluid throughout the body. So the more fluid you hold on to, the higher your blood pressure may be. Another hormone that contributes to blood pressure is aldosterone, and that is the end result of the RAA system, the Renin-angiotensin-aldosterone system. And these hormones are big contributors to blood pressure levels. Angina, also known as chest pain, and that can be due to an imbalance between the heart muscle's oxygen supply and then demand. So many times people with heart diseases, they will get chest pain, angina pectoris, when they are doing physical activity. And if the heart needs more oxygen than is available in the body, that's going to cause chest pain. Ischemia, that is decreased blood and oxygen supply to the tissue. Another term we need to know, infarction, and that is the death of some tissues in the heart, which leads us to what an MI is. MI stands for myocardial infarction, also known as a heart attack, and that can occur when our coronary artery is totally obstructed. And remember that coronary artery is what feeds the heart muscle itself. So if it's obstructed with things like cholesterol, plaque, cellular debris, that limits the amount of oxygen and blood that can get to our heart tissue. So when those coronary arteries are totally obstructed, that can lead to prolonged ischemia and possible cell death or infarction of the heart wall. The most common cause of MI is atherosclerosis, usually due to a thrombus that is attached, a clot. Initial treatment of an MI consists of the acronym MONA, M-O-N-A. M stands for morphine. We give morphine for the pain. We want to apply oxygen, oxygen, to help keep all the tissues oxygenated. Nitroglycerin we give, and then aspirin. So MONA, morphine, oxygen, nitroglycerin, and then aspirin. And aspirin will kind of help to thin the blood so that we can try and reduce the chance of a clot causing severe damage. Atherosclerosis, that's the buildup of fats, cholesterol, other substances in or on the artery walls, which can obstruct blood flow in coronary artery disease. Often there's no symptoms until a plaque ruptures or the buildup is severe enough to block blood flow, leading to ischemia. A healthy diet and exercise can help in the prevention of this. Treatments include medications to reduce cholesterol, like a statin, and procedures to open blocked arteries and surgery. So some of those may be like an ablation. We put a little balloon inside that coronary artery, kind of inflate it. It kind of packs down that buildup. Modifiable risk factors for coronary artery disease include getting out of a sedentary lifestyle. So we want people to exercise, move around. We also want people to take control of their high blood pressure, hypertension, and we can do that through diet, exercise, and smoking cessation. Shock, also known as hypotension, can result from decreased circulating blood volume, leading to decreased tissue perfusion and general hypoxia. In most cases, cardiac output is low. The causes include hypovolemia, which means low blood volume. Another cause could be cardiogenic, and that is where the heart's capability of pumping is decreased. Another cause of shock is vasogenic, and that is due to vasodilation owing to loss of sympathetic and vasomotor tone. Anaphylactic shock, also known as systemic vasodilation, is due to increased permeability owing to a severe allergic reaction. And then our last cause of shock, septic shock. and that is basically vasodilation owing to a severe infection, often with a gram-negative bacteria. Moving on to our next point, we're going to be looking at valvular defects, so defects within the valves of the heart. Malformations, so congenital malformations, things that people are born with, most commonly affect the aortic and the pulmonic valves. Valve problems may be classified as stenosis or a narrowing of the valve. And when we have that narrowed valve, it restricts the forward flow of blood, also known as valvular incompetence. And that is basically a failure of a valve to close completely, which allows blood to regurgitate or leak backwards, which we absolutely don't want. Tetralogy of Fallot is the most common cyanotic congenital heart condition, which it alters pressures within the heart, and therefore that alters blood flow. So there's going to be marked systemic effects as well as cyanosis, that bluish coloring of the skin, which indicates that we are not getting proper oxygenation to our tissues. Treatment for that consists of surgery. Looking at the heart's conduction system, it's important to know that our heart is stimulated with electrical activity. And this electrical activity is what helps tell the heart to either speed up or slow down. When those electrical impulses speed up through the heart, that causes the heart rate to go up. So all cardiac muscle cells can initiate electrical impulses, but normally the conduction pathway originates in the sinoatrial node, also known as the SA node. The SA node is located in the right atrium. It's often referred to as the pacemaker of the heart. So that is the node who is in charge of the heart's rate. So it usually fires normally at a rate of 60 to 100. And depending on a person, what they're doing, are they doing physical activity? Are they at rest? That SA node will either speed up or slow down to meet the body's demand. Impulse is generally normally generated in that SA node. It travels through the atria to the AV node, also known as the atrioventricular node. And that usually fires at a rate of 40 to 60. And that may, if there's an issue with the SA node where it's not working properly, the AV node can take the lead. However, it can only fire a heart rate of between 40 to 60. So it's not going to be able to meet the body's demands for an extended period of time in that AV node. After the AV node, the bundle of His is the next structure involved in the heart's conduction system. That can fire at a rate of 20 to 40 beats per minute. And if you have your heart's electrical signal originating in that bundle of His, that is really going to decrease the heart's ability to meet the body's demands. After the bundle of His, we have the Purkinje Fibers, and eventually that leads to the ventricular myocardium. So we have these different nodes in the heart's electrical conduction system. It starts in the SA node, travels down to the AV node, to the bundle of His, Purkinje Fibers, and then to the ventricular myocardium, so the bottom of the ventricles. So it's kind of like the heart, it signals, to contract, like that. And so if there's an issue in any one of those nodes, it's going to affect the heart's ability to pump blood efficiently around the body. Looking at the different kinds of cardiac arrhythmias and dysrhythmias, that occurs when these electrical impulses in the heart don't work properly, which causes the heart to beat irregularly too fast or too slow. So some examples of that: atrial fibrillation, also known as AFib. We got atrial flutter, ventricular fibrillation, SVT, supraventricular tachycardia. So there's an issue with the heart's electrical conduction system, that SA node, AV node. There may be an issue in the bundle of His, maybe the Purkinje fibers. So any issue anywhere along that electrical pathway can lead to a dysrhythmia or arrhythmia. And if those arrhythmias and dysrhythmias go on long enough, it's really going to affect the heart's ability to pump blood efficiently throughout the body. Symptoms of arrhythmias may include a fluttering in the chest pain, also known as angina, fainting, dizziness. Treatment may include anti-arrhythmic drugs, medical procedures, an implantable device like a pacemaker, or possibly surgery. Looking at our next heart condition, we're going to look at heart failure, and that's a chronic condition in which the heart does not pump blood as well as it should. Heart failure can occur if the heart cannot pump systolically or fill diastolically adequately. Symptoms of heart failure include shortness of breath, fatigue, swollen legs, rapid heartbeat. Treatments can include eating less salt, limiting fluid intake, taking certain prescription medications. In some cases, a defibrillator or pacemaker may be implanted. Looking at the differences between right-sided heart failure versus left-sided heart failure, it's important to note that in left-sided heart failure, it can cause a pulmonic congestion backup. So symptoms of left-sided heart failure include dyspnea, cough with pink frothy sputum, and crackles. So anytime we have left-sided heart failure, think of a backup of fluid in the lungs. So left-sided heart failure, it's going to affect the lungs. Right-sided heart failure, the congestion is apparent in the systemic circulation, also known as basically the rest of the body. So you can remember right-sided heart failure, there's going to be a backup of fluid in the rest of the body. Symptoms include increased blood backup in the legs and feet, so they may be swollen. You can have an enlarged liver, spleen. You may have distended jugular distension. And that's characteristic of that right-sided heart failure where the congestion in the systemic circulation results in this jugular venous distension. Looking at inflammation and infection of the heart, the first thing that we want to consider is rheumatic fever. And that is an acute systemic inflammatory condition that appears to result from an abnormal immune reaction occurring a few weeks after an untreated infection, usually caused by certain strains of group A beta hemolytic streptococcus. So basically a person may have strep throat. If that strep throat is not treated, it can lead to rheumatic fever. Symptoms are low-grade fever, leukocytosis, malaise, anorexia and fatigue, tachycardia. There may be a heart murmur present, a nosebleed, also known as epistaxis, or abdominal pain may be present in rheumatic fever. And treatment of that will consist of antibiotics. Pericarditis is another inflammation of that heart. We got the inflammation of the pericardial sac, which helps protect and surround the heart. And that's usually secondary to another condition in either the heart or surrounding structures, like that pericardium. This can lead to a buildup of fluid around the heart, which can affect cardiac output. Causes include open heart surgery, myocardial infarction, rheumatic fever, systemic lupus erythematosus, cancer, renal failure, trauma, or viral infection. Symptoms that may be present are chest pain, dyspnea, cough, electrocardiogram changes, and possibly a friction rub may be present in pericarditis. So the primary problem in pericarditis must be treated successfully. Fluid may be aspirated from the cavity, also known as a paracentesis. We are going to analyze that fluid and then determine the cause. If effusion is severe, immediate aspiration of the excess fluid may be required to prevent cardiac tamponade and shock. Infective endocarditis concerns defective heart valves that are invaded by organisms of low virulence, such as Streptococcus viridans, or of high virulence, such as Streptococcus aureus, which causes severe tissue damage and is more acute. Symptoms include anorexia, splenomegaly, enlargement of that spleen. There can be a release of bacteria into the bloodstream, which can lead to intermittent increased fever. Congestive heart failure can develop in severe cases. Acute endocarditis has a sudden marked onset, such as spiking fever, chills, drowsiness, and heart valves that are badly damaged, causing severe impairment of heart function. And that acute endocarditis is what's associated with the higher virulence strains of bacteria, such as Streptococcus aureus. To diagnosis, we may use a TEE, transesophageal echocardiogram, and we can use that to visualize the presence of any growths or vegetations on those heart valves. Treatment will consist of doing a blood culture or rapid test to identify the causative agents. Once we identify it, we can use antimicrobial drugs, usually for a minimum of 4 weeks, because we want to make sure that we eradicate that infection completely. Other medications to support heart function is usually required as well. All right, so that wraps up our cardiac patho class for today. Really hope that you enjoyed this video. Definitely, if you found it helpful, give me a thumbs up, subscribe to the channel, give me some comments down below, give me some feedback. That's always appreciated. We'll see you next video.